went to see my doctor, and they thought I had the flu. And they ordered some Tamiflu for me, and I went home. Then on Sunday, kids were over for dinner, and apparently I wasn't making any sense. So they called 911, and they took me to the hospital.
The concerns that we were seeing in the media, all of a sudden that was going to be a reality here at our hospital. And there obviously is, in the back of everybody's mind, a concern that, wow, this is something, we don't know how contagious it is, we don't know anything about its infectivity. You know, that evening, Mr. Pilder was not doing well.
I remember right before they intubated me, the nurse explaining to me what they were going to do. And I looked at him and I said, "I'm afraid." And he said, "I'll pray for you."
Mr. Pilder's oxygen level started to then drop while he was maximized on a ventilator. And that pretty much means you are going to die. And we were all trying to figure out what medications he ought to be on. But at that moment, what he needed was oxygen. Dr. Al-Shatir, he went into the room, and he spent 90 minutes in there. And I'm sorry, I am not a teary type of person. I promise you, I'm not an emotional person at all. But that was special, I think. Because what he did was he moved him to increase his oxygenation. And had he not, I think he would have died.
They woke me up, I guess it was 28 days later, okay, from a medically induced coma while I was on the ventilator and the ECMO machine. But no one was allowed to see me except doctors and nurses.
One of the worst things about this disease is that most of the people that have died from it have died alone. So you can't come into the hospital, you can't be with your family members, you are seeing them from afar, and our nurses made sure that whenever they could FaceTime through the iPad.
In addition to taking care of me, the nurses were great company, okay? Because you do feel alone. You're just isolated, you know? And that's obviously not a great feeling. The doctors and the nurses here were fabulous. These people genuinely cared about what they were doing, and it was amazing to watch. They came into the room and they said, "The last test came back negative, you're going home. Okay, we're gonna have a little send-off for you in the lobby on the way out."
So the day that Mr. Pilder went home, it was fantastic. We had opened up the front of the hospital.
They wheeled me down into the lobby, and it was overwhelming. The place was packed with doctors and nurses. My wife was able to come up and give me a hug. For the first time in 48 days, my kids and my grandkids were there. On the way out through the lobby, Dr. Brooke, my primary physician, gave me the great pleasure of introducing me to Dr. Al-Shatir. When I heard the whole story of what he did for me, okay, I mean, he really put his life in jeopardy for little or nothing that we knew about the virus at that time.
Dr. Brooke, he told me a lot about Mr. Pilder, his background. You know, he owned a deli in the community. He was known in the Jewish community. And, you know, we had a moment where, you know, this Dr. Al-Shatir, who is from Iraq and a Muslim, you know, there was some beauty there.
When I got home, I was able to sit out on the deck with the kids and my wife, and it was just nice to be alive and be outside. I owe those folks a debt that I can't repay. And they should know that they'll be forever in my heart.